Hi, Dr. Rudy Kachmann. Welcome to our Wellness Talk, which we have every week. Watch some of our old ones, and it will help you live a normal, healthy life. They're very interesting. Today's is about addiction. You know, we've spoken before about opioid addiction rate, but this one here is our next addiction crisis, anti-anxiety Benzodiazepines, benzos, which a lot of people take, and the doctors prescribe them like they're not very serious medication. But Xanax, Valium, Ativan, and Klonopin are used a lot of the times in combination with opioids and even by themselves. I had a pharmacist tell me today that some people will take two benzos at once, two different medications, say Xanax and Valium together, and they can be extremely dangerous. I even was reading about a doctor who himself had become habituated or addicted to them, as you might say, who says you shouldn't take them more than 2 or 4 weeks because you can become habituated to them. You got to keep on taking them to feel right, and also there's danger in stopping them. For example, if you saw the show, you might say, well, geez, I'll stop mine. Well, you need to speak to your doctor because some people, from stopping them abruptly, can have seizures. There have been some sudden deaths seen from them. So I recommend that you avoid the medications if at all possible. Find other ways to relax and feel better, like exercise or dancing or singing, things that I do, taking a walk in nature. But some people have to take them, no doubt about it. But I want you to know these are dangerous medications. Now some state pharmaceutical organizations, actually state organizations that control drugs, are starting to make recommendations and put laws down as to the amount of pills you can pick up, maybe a week's supply or a 2-week supply, and help teach the provider on stopping them. But again, if you can avoid them, if at all possible, avoid them. Another thing I like to speak aloud a little bit, speaking about medication, is children. A lot of parents today don't realize that babies are crying or children growing up being very active and maybe too active is not normal. Well, I mean, some kids is that normal, but a lot of kids, and even a pharmacist was telling me about some neurons, and they're controlling their activities with Adderall, Focalin, methylphenidate, Biban. These are C2 drugs. Guanidine is another one to give the children to quiet them down. What parents don't realize, that a lot of these are normal activities for a child. For example, I watched a deer this morning eating out of my bird cages. Yeah, he's in there, but he had a child. And there's a little beach in front of a pond that I own, maybe barely 50 feet away. You know what the child was doing? I never seen this, miss. Jumping and somersaults and turning over. That's a normal child. And so can your child be, but to drug them, and a lot of people have, you know, some have 5 or 10 kids. I can see the point, but you can't just drug them in these medications, wrap them up, and there are going to be some problems. There can be some sudden deaths, for example. So I discourage you from using these medications unless necessary. I mean, some children have ADHD or ADD, these syndromes that we attention deficits disorders, but a lot of them are just normal, active children. Give them a hug, play with them, and maybe not have 5 or 10 children because they're difficult to keep track of. I give this little talk because we love you, we care about you. So pay attention about the medications you're taking in, because this epidemic of opioids and benzos and marijuana and cigarettes and alcohol is hurting us and our children. I gave this a little talk today because I love you. I care about you. Watch your other posts. Thanks so much.